Hello, I am KaLeigh Pittman, an intern with Morehouse School of Medicine. Today, I will be presenting findings of a research study on the perceptions of Black families on community-engaged diabetes prevention intervention. First, we must discuss the impact of type 2 diabetes. Type 2 diabetes is a chronic condition marked by increased insulin resistance and decreased insulin sensitivity, resulting in elevated levels of blood glucose. Uncontrolled type 2 diabetes can lead to serious complications, such as kidney failure, vision loss, nerve damage, and increased risk of cardiovascular disease. In Georgia, type 2 diabetes is the seventh leading cause of death among adults, and Blacks have nearly twice the number of diabetes-related deaths each year compared to the overall U.S. population. This study aims to understand the perceptions of Black families in Albany, Georgia toward community resources, and explore how the implementation of community feedback can inform the Families Implementing Good Health Traditions for Life, or Fight for Life study, a family diabetes prevention program. For methodology, we begin with discussing the study's eligibility criteria. To be included in this study, parents must be aged 18 or older, residing in the same household as the child. They must be the child's biological parent or have legal guardianship. The parent must also self-identify as African American or Black and have a hemoglobin A1C level between 5.7% and 6.4%, indicating prediabetes. And finally, the parent must have no plans to move from Albany, Georgia in the next 2 months. The child must be between the ages of 8 and 15. These criteria were designed to stimulate the eligible demographic that will be included in the Fight for Life study, allowing us to understand the priorities and barriers this community faces. To get their feedback, families engaged in 5 semi-structured focus group discussions, each lasting 2 hours. With consent, parents and children were interviewed separately. These discussions focused on daily routines, access to resources, family togetherness, and perceived barriers to accessing resources. All discussions were audio and video recorded and later analyzed using rapid analysis procedure sheets to identify key themes. In review of our results, the study contained a total of 19 families, 1 parent and 1 child from each family. The average adult age was 41 and all parents were female. 52.6% of parents worked full-time, and 73.7% of parents made less than $40,000 per year. The average child age was 12, with 57.9% of children being male and 42.1% being female. Our first key theme is program implementation. Participants cited program location and transportation-related expenses as potential barriers, saying, "I think about the expenses as far as getting there. I'm thinking like spending money on gas, and if there wasn't an incentive, it would feel like my doctor's appointment," referring to the proposed intervention. Healthy food barriers were identified as another key theme. Participants stated, "That's awesome, but some families cannot get a hold to those fruits and vegetables on a daily, or they may not have the funds. Some people that may not have the funds to go and keep up with their diets." Physical activity barriers has also been identified as a key theme. Participants stated, "Not enough time, I would say. Time just flies out so fast. 8:35, pick them children up, homework, fixing food, it's time to go to bed." So tight schedules and lack of safe exercise environments were specifically cited as barriers. This concludes my results. Now I will talk about discussions, next steps, and implications. In the future, the findings from this research will be used to culturally adapt the proposed diabetes research intervention, ensure that the activities in the intervention will be family-centered, support retention, and reinforce healthy behaviors for enrolled Black families. The findings from this study offer critical insight for refining future diabetes prevention interventions among Black families at risk for prediabetes, and community feedback that can address a lack of information regarding resources such as physical activity and nutrition that aid community members in living a healthy lifestyle. Please pause and scan the QR code shown here to access the references for this study, which are included at the end of the abstract. I would like to acknowledge the mentoring staff from Morehouse School of Medicine, Albany Area Primary Healthcare, and the participating families for openly sharing their perceptions. The final bullet point shows our grant number. Thank you to our funders. Thank you.